Hello everyone, welcome to sqadia.com. My name is Dr. Saima Mushtaq and our today's topic of infectious medicine is the toxoplasmosis or toxoplasma infection. This topic we will cover in three different sections. In the first section, we will discuss the congenital toxoplasmosis. Life cycle of Toxoplasma gondii. This is the most common causative organism of toxoplasmosis. So we will try to cover it in detail, all about the life cycle, transmission and pathogenesis of Toxoplasma gondii, and then the pathology and host immune response as a result of the Toxoplasma gondii infection. So that will be in the first section. Then in the second section, we will talk about the diagnosis of toxoplasmosis in immunocompetent patients, patients whose immune response is strong enough or they are immunocompetent. Serology and molecular diagnosis of toxoplasmosis. Then we will discuss the immunocompetent host and ocular toxoplasmosis. Then in the third section, we will discuss the treatment of toxoplasmosis, what's the primary prophylaxis, infection in immunocompetent patients, long-term maintenance therapy. If it's the once we will start the toxoplasmosis, you will see we need sometime the long-term maintenance therapy for the toxoplasmosis and how we can prevent this condition. So in today's topic of toxoplasmosis, we will try to cover all the aspects, pathology, pathogenesis, life cycle of the causative agent, how we can host immune response develop, and then we will discuss about the different methods of diagnosis and options of the treatment available for the toxoplasmosis. So keep watching sqadia.com.